So let's talk about nattokinase. You've probably heard the buzz around it, right? It's showing up everywhere, from online forums to the supplement aisle. But as someone thinking about their health, you really need to know what the actual science says. Okay, let's dive in.
So what's the real story here? Is this the breakthrough heart health supplement that everyone claims it is? Or is it just another bottle of empty promises? That's really the core question we're going to answer today, and we're going to use a clear, evidence-based approach to help you figure out if it's right for you. First things first, what even is nattokinase? Well, it's a natural enzyme, and it comes from a traditional Japanese food called nattō, which is basically fermented soybeans. Its main claim to fame, and really what got scientists interested in the first place, is its powerful ability to break down blood clots.
To get you the answers you need, here's our game plan. We'll start with the basics, which we just covered. Then we'll look at the strongest evidence for blood pressure. After that, we'll get into the crucial difference high doses make, especially for plaque and cholesterol. Then, of course, the risks. And finally, we'll wrap it all up with a clear patient takeaway.
Okay, so section 1, the basics, is done. Simple enough, right? Now, let's get into the evidence, because this is where things get really interesting. We're going to start where the science is the most solid. And when it comes to managing high blood pressure, nattokinase has some of the most robust and consistent evidence backing it up.
So check out this number, -3.45. A big 2023 review of high-quality studies found that on average, nattokinase lowered systolic blood pressure, that's the top number in a reading, by almost 3.5 points compared to a placebo. Now, that might not sound like a huge amount, but in the world of blood pressure management, that's a real, statistically significant drop.
And this table here, it shows the data pretty clearly. The big analysis confirmed the drop for both the top and bottom blood pressure numbers. And just look at that p-value. For us non-statisticians, a number that small means the result is extremely unlikely to be just a fluke. So the key takeaway here is pretty clear. For blood pressure, the evidence is strong.
But okay, what about other things? Like what if you want to reduce arterial plaque or maybe lower your cholesterol? Well, this is where the story gets a whole lot more complicated. And it all comes down to one really critical factor, the dose.
All right, this slide right here. This is probably the most important thing to understand in the whole nattokinase debate. On the left, you see the results for a standard low dose, the kind you see on most supplement bottles. At this dose, good studies found it did nothing for plaque, 0. Even worse, for cholesterol, some studies found it could actually make the numbers worse. But now, look at the right. A huge study using a really high dose found it could shrink plaque size by up to 36% and significantly improve your entire cholesterol panel. I mean, it's not even a close comparison.
I absolutely love this analogy from the research. Using that standard low dose for something like plaque is kind of like lightly sprinkling a little fertilizer on your garden. It probably won't do any harm, but you're not going to get any big, impressive results. If you want those powerful headline-grabbing outcomes, you need that professional-strength dose.
And this chart, it just says it all, doesn't it? It makes the point impossible to ignore. On one side, you have the high-dose group seeing a massive 36% reduction in plaque. And on the other side, the low-dose group, with basically 0 change. So if your goal is to actually tackle plaque buildup, the dose isn't just a minor detail. It's everything.
Okay, so we've seen nattokinase can be pretty effective, especially at those high doses. But that leads us to the most important question of all: is it safe for you to take?
Now, the good news is that in all the clinical trials, nattokinase has been shown to be very well tolerated, even at those super high doses we talked about. When it's taken by itself as a monotherapy, studies report no major side effects. However, and this is a really big however, the real danger isn't the supplement itself. The key risk, the thing you absolutely have to be aware of, comes from drug interactions. And this isn't just a theoretical risk. Take a look at this quote from a published medical case report. It's pretty chilling. It describes a patient who had a brain hemorrhage after taking both nattokinase and a daily aspirin. See, nattokinase thins the blood. So if you combine it with other blood thinners like aspirin, warfarin, or Plavix, you can create a dangerous stacking effect, which dramatically increases the risk of a major bleed. This is not something to take lightly.
So, after all that, what are you supposed to do with this information? Let's try to boil it all down into a clear, actionable framework to help guide your decision, and more importantly, your conversation with your doctor.
Here are 4 simple steps to take. First, define your goal. Are you looking for that modest blood pressure benefit, or are you aiming for those more dramatic plaque and cholesterol effects? Second, understand the dose needed for that goal. Third, and this is the big one, the absolute non-negotiable step, review all your medications. Are you on a blood thinner of any kind? And fourth, talk to your doctor. This is a tool to help you ask smarter questions. It is not a substitute for real medical advice.
So as you can see, the takeaway here isn't a simple yes or no. The evidence shows Nattokinase has real benefits, but they're very specific, and it comes with very real risks. It's a powerful tool, but one that demands respect and a clear understanding of the science. So the ultimate question isn't whether you should take it, it's this: armed with this evidence, what informed questions are you now going to ask your doctor?